Welcome! Today, we're going to break down the ultrasound-guided popliteal sciatic nerve block. If you're doing any kind of surgery below the knee, this is a technique you've just got to have in your toolkit. Honestly, getting this right can be a total game changer for your patients and your practice. Okay, so here's our game plan. We're going to start with the why, when, and why you'd even choose this block. Then we'll get into the really important stuff, the anatomy. We'll cover positioning, the actual block procedure, and of course, safety. And we'll finish up with some pro tips that'll really take your technique to the next level.
All right, first things first, let's talk about why this block is so darn useful. When should this be the first thing that pops into your head? Well, let's look at where this technique really shines.
The list of applications is huge. Think about it. Major foot and ankle surgeries like bunionectomies or ankle fractures, Achilles tendon repairs, you name it. It even works great for below-knee amputations. It just gives you fantastic coverage for the surgery and, maybe more importantly, for pain control afterwards. Okay, let's get into the anatomy. You can't hit a target you can't see, right? So we need to have a really solid mental map of what's going on in the popliteal fossa before we ever pick up a needle. So the real star of the show here is this thing called the perineural sheath, or Voloc's sheath. You can just think of it as a tough little envelope of connective tissue that's wrapped around the nerves. And this sheath, it's the absolute key to a successful block, because it acts like a perfect little container for our anesthetic, keeping it right where we want it. And I love this analogy. It makes it all make sense. Imagine the main sciatic nerve is a torso. The two nerves it splits into, the tibial and peroneal, are the legs. And that sheath, well, that's the pair of pants covering them both. Our entire goal is to get the anesthetic inside the pants, so it surrounds both legs. But, and this is critical, not into the legs themselves. It's an intra-sheath but extraneural injection. Which, of course, leads us to the million-dollar question, right? For the best and safest block, where exactly are we aiming to get inside those pants? So here it is, the sweet spot. It's that perfect little area right where the two nerves are just beginning to pull apart, but they're still neatly tucked inside that single shared sheath. This gives us the perfect little pocket to place our needle tip right between them.
Okay, we've got our anatomical map burned into our brains. Now let's get practical. How do we actually position the patient and use the ultrasound to find that sweet spot?
You've got three solid options here, and really the best choice just depends on the situation. Prone is probably the most direct. Lateral is often way more comfortable, ergonomically speaking. And supine, with the leg propped up, is a fantastic problem solver, especially for trauma patients you can't roll over.
All right, when you start scanning, you want to be systematic. I like to start just above the crease behind the knee and find my vessels, the artery and vein. The tibial nerve is going to be right there, superficial to them. Now, slide your probe up the thigh, and you'll literally watch those two nerves merge into one. Then, and this is the key, slowly slide back down until you see them just start to split apart. Boom, that's your sweet spot. All right, we've found our target. Now for the main event, performing the block. We're going to walk through the needle approach, the injection itself, and the safety checks that are, believe me, absolutely non-negotiable. So you've got a choice. In plane, where you see the whole needle, shaft, and tip, or out of plane, where you just see the needle tip as a bright dot. An in-plane approach from the lateral side is really common. But here's the bottom line. No matter which you choose, you have to see your needle tip. Always. That's the one rule you can't break.
Now this is a really cool part. As you carefully advance your needle, you're going to feel something. It's this distinct little pop or a click as you pierce the sheath. That feeling is just so satisfying. It's a great confirmation that your needle tip is exactly where you want it. The second you feel that pop, just pause for a second. Inject a tiny bit of saline and watch on the screen as it opens up that space. It's called hydrodissection. Once you've confirmed your end, you can slowly inject the full volume. And what you want to see is that local anesthetic spreading out like a beautiful crescent, just wrapping around both of those nerves. Now, before and during that injection, you absolutely have to perform the wrap safety maneuver. Think of this as your final safety net. It's what helps you avoid nasty complications like injecting into a blood vessel or, worse, into the nerve itself.
Just remember, wrap. R is for response. If you're using a nerve stimulator, you shouldn't see any muscle twitch below 0.5 milliamps. A is for aspiration. Just pull back on the syringe, make sure you don't see any blood. And P is for pressure. The injection should be easy. If you feel any real resistance, stop. A high-pressure injection is a massive red flag that your needle might be inside the nerve.
Okay, let's wrap this up with a couple of pro tips. These are the little things that'll help you when a scan is tricky, and they'll help you confirm your block is perfect. This is what takes you from just doing the block to really mastering it.
So we've all been there, right? You're scanning away and everything just looks kind of gray and smudgy. The nerves aren't really popping out. What can you do? Well, you've got two awesome tricks in your back pocket. First is the dancing nerves tip. Just ask your patient to move their ankle up and down. You'll see those nerves start to slide and move on the screen. It's amazing. Second, remember anisotropy. Nerves can look bright or dark depending on the angle of the ultrasound beam. So if your nerve looks dark, just tilt or rock your probe a tiny bit. It can make it light up like a Christmas tree. Okay, the local is in. It looked good on the screen when you injected it, but how can you be 100% positive that you nailed it and that your patient is going to have a fantastic, dense block?
This is the ultimate confirmation, and it's so easy. After you inject, don't take the probe off. Just slide it a few centimeters up the thigh, proximally. If your injection was in that sheath, you'll see the local anesthetic tracking all the way up, surrounding the main sciatic nerve. Seeing that spread is definitive proof of a perfect block.
So, we've gone through the steps, the anatomy, all the tips and tricks, but really, the thing that separates a good block from a truly great one is going beyond just knowing how to do it and deeply understanding why you're doing every single step. When you understand the why behind the anatomy, the sweet spot, the safety checks, that's when you can truly adapt, troubleshoot, and perform this block with total confidence. That's mastery.